We are the Center for Advancing Health Outcomes, research that transforms care, policy, practice, lives. Visit us at advancinghealth.ca.
Welcome, everyone. We're gathered here today at St. Paul's Hospital, which is on the unceded territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. And if you're gathered somewhere else today, please feel free to take a moment to acknowledge that space and make a note in the chat if you'd like. We're delighted, though, to have Trevor here with us today. Trevor and I are both colleagues at UBC. He's a new assistant professor as of July 2024, and he's a registered nurse and an assistant professor in the School of Nursing at UBC. His background includes working in inpatient adult mental medicine, community mental health, and emergency and inpatient child and adolescent mental health. And most of his clinical work informs his research program. Trevor's research takes a social approach to the study of substance use, mental health, and related health and healthcare experiences, with the aim of developing more nuanced understandings of these issues and the social and structural context in which they are experienced. Dr. Goodyear is recognized as an emerging leader in youth health, mental health, and substance use. And he has a strong track record of leading impactful research and knowledge translation. And he's going to be speaking to us today about his PhD work. So please welcome Trevor Goodyear.
Today, I'm really excited to present this talk, which has a bit of a punchy title, and that's Advancing Homes of Substance with 2S LGBTQ+ Youth. And I'll unpack this as I go. But the gist of this talk is that I'm going to explore how trajectories of substance use and homelessness can intersect for 2S LGBTQ+ youth in Vancouver. Thank you as well for the land acknowledgement. I do want to emphasize that the work of this study also took place on unceded Coast Salish territories, including those of the Musqueam, Squamish, and Tsleil-Waututh peoples. And today I'm presenting on a photovoice or participatory photography study. And this is one of the photos taken by one of the young people I got to work with. And her name is Axel. This is a fake name or a pseudonym, but she titled this photo Roots. And with the photo, she really highlighted how historic and ongoing racial and colonial inequities had profoundly shaped her family's history of substance use and her own experiences or trajectories of substance use and homelessness. The photo also highlights the politicalities and resistance of this young person and of many of the young people I got to interview as part of this work. And as I was working with youth, I really did have the privilege of learning from and with them about creating a sense of home, belonging, and that experiences of becoming in a city. And I really did get to learn a lot from those young people, so thank you to them. I had a really good introduction, so I don't have too much else to add, but I will just say that I've been a nurse for nearly 10 years. And in much of my work, both clinical and research, I've really enjoyed working with people who use drugs. At the same time, I've been quite frustrated with some of our gaps in policies and gaps in approaches to care with folks who use drugs. And that was kind of the driving force of me to pursue graduate school, eventually find my home in youth substance use research, and then here I am today at UBC Nursing. As this photo shows, I'm going to take you down a bit of a road through this study. So I'll talk a little bit about some key terms, very brief background, talk about what we sought to look at for the research and how we did it, and then what we found and some of the ways that we're getting knowledge from this study out into the world and back to community. I'll talk for about 40 minutes or so, and then we'll have time for questions. So please do make a mental note or a written note if anything comes up through this talk, because I really want to talk afterwards. In terms of some key concepts, when I say 2S LGBTQ+, I'm referring to two-spirit, lesbian, gay, bi, trans, queer, and other sexual and gender minority people. So certainly an umbrella term and a wealth of diversity within this umbrella term. And then when I say youth, for the purposes of this study, we were talking to young people between the ages of 14 and 29. So a pretty broad range. But that said, we were doing a lot of our recruitment through local youth services, and many of those have a upper age limit of 24 or 25. So it was a fairly younger group, mostly in early 20s. And then when I talk about homelessness, I think about this in pretty broad terms. And I encourage the young people I work with to do so as well. So thinking about homelessness as perhaps a lack of shelter, of housing, but also that feeling and experience. So not feeling secure or safe or belonging, etc. And I really encourage the young people I work with to tell me what they mean by homelessness. And in our setting in Vancouver, I also consider unstable housing to be a form of homelessness. So when we think about, shelter surfing young people or couch surfing or people staying in low quality social housing or transitional or modular housing units, these can in and of themselves constitute a form of homelessness. And that's certainly what the young people I work with have told me loud and clear. And finally, I'm also taking a constructivist or broad approach to substance use and thinking about the full range of substances, including regulated and unregulated substances. And most often in this work, you've talked about cannabis, alcohol, opioids, and stimulants, but there were others as well. By way of background, we know that homelessness inequitably impacts 2S LGBTQ plus people. So it unfairly, disproportionately impacts this group. And 2S LGBTQ plus youth are estimated to comprise between 20 to 40% of the overall population of youth experiencing homelessness in North America. So a huge proportion, an unjust proportion. Similar inequities are seen in the context of substance use. So 2S LGBTQ plus youth have higher rates of substance use, as well as inequities when it comes to substance use harms and barriers to accessing services like education, information about substance use, harm reduction, treatment, etc. A few years ago, when I was doing an addiction medicine research fellowship with the BC Center on Substance Use, I had the chance to work on this photovoice study about opioid use among 2S LGBTQ plus youth. And that's listed up here. In this study, I got the chance to learn from young people about the intersectionality of substance use, housing, and identity. And it really piqued my interest in thinking more about social and material context. So these are some photos from that earlier study. It's just published in 2023, but the work was done, I think, back in 2021. It was a long process. And as some of these photos show, these are a select few. To me, they really speak quite directly to issues of identity and to finances and shelter or housing. And these were themes that came out very, very often throughout the research. However, that study was looking at substance use at a particular moment in time, so youth's current lives, and didn't really have that retrospective or life course approach. So although we got to learn a lot from these young people, there were also some unanswered questions about how substance use and homelessness had featured in earlier points of their lives and how they had intersected. So this led me into my dissertation research. And my dissertation research, the study I'm talking about, was again looking at those intersecting trajectories of substance use and homelessness in 2S LGBTQ plus youth. I had come to this work with quite a bit of clinical and research experience on the substance use side, but much less so thinking about housing and homelessness. So I started this work with a scoping review specifically about homelessness among 2S LGBTQ plus youth. And this was a scoping review of 27 studies published across the globe. Many of them were North America, though. I won't go into too much depth with the scoping review findings because I want us to get to the qualitative findings and the pictures and the quotes. But I will say that, this review did kind of help to ground me in the homelessness literature and to learn more about that with this population. And we organized findings from the review into 3 key themes. And each of these themes represents a particular transition or process related to homelessness. So first, leaving home. How do 2S LGBTQ plus youth leave home or leave the child welfare system? And what are the kind of driving forces behind that? Second, once homeless, how do they navigate street and shelter life? And third, how do they orient toward the future once homeless? So what kind of supports and resources do youth draw from to build a more secure sense of home and future for themselves and their communities? In this research, I did have that kind of idea in the back of my mind that I was going to think about substance use. And I was quite surprised that substance use was not really discussed in the included literature. And when it was talked about, it was often only at a surface level and didn't go into any real detail. And at the same time, when I think back to my work on substance use specifically among 2S LGBTQ+ youth, there's very little attention to housing, to homelessness, or to class or socioeconomic status in general. So I really wanted to study these issues together and to see about how they intersect. And I thought this was particularly key in our context where youth are grappling with overlapping housing and drug toxicity crises, which we know can distinctly and inequitably impact young people. I'll also say that around this time, I was working with Dr. Dania Fast at UBC and the At-Risk Youth Study or Youth Health Advisory Council. And we planned a youth housing summit where it came up very strongly that substance use was key to consider in housing and homelessness. So that brought me to my dissertation study, which just wrapped up a few months ago, but was running over 3 or 4 years. And this study sought to address 3 research questions, and they revised throughout the study. So the first, how do 2S LGBTQ+ youth position their substance use in relation to pathways to homelessness, so in the lead up to homelessness? Second, how do drugs shape practices and contexts of homemaking? So, even in the lack of a physical home, how do youth maybe use drugs to feel more at home or to feel more secure, safe, comfortable, at ease, etc.? The third question was about how 2S LGBTQ+ youth navigate and negotiate outness in the context of homelessness. And this was mostly in terms of outness with gender, with sexuality, but also other parts of their identities. And that third research question is a little bit less about substance use. And that really emerged more from the data and from what youth were telling me. So this was a priority for research participants. I'll unpack these as I go. So this research project took a community-based research design or a participatory design, and it was grounded in a critical interpretive paradigm or standpoint. And by this, I mean that I really sought to co-create knowledge with young people. So really leveraging my own expertise as a researcher, as a clinician, my own lived experiences as a gay person, and also the expertise and knowledge of young people that I got to work with and many others involved in supporting this work. I recruited young people between the ages of 14 and 29, and they all had past year experience of substance use and homelessness as defined by youth. They were all also 2S LGBTQ+. We had a very diverse group of young people and 32 people overall in the study. And again, mostly in those like early 20 ages, I would say. I took a multi-pronged recruitment approach that leveraged the At-Risk Youth Study or ARISE, and I was working there, so getting to connect with youth as they came in. Big thank you to the folks there. And also postcards distributed at organizations in the Lower Mainland. So Covenant House, Directions, Foundry, we have some folks here, Anya and others who really made this work possible. Then I was also going to youth drop-ins at local shelters, so at Covenant House and Directions, and I was going there at the peak of data collection a couple times a week and getting to connect with young people there and tell them about the study and see about scheduling an interview or doing the interview on the spot if they were interested. Data collection for the study took a photovoice approach or that participatory photography approach, and it occurred in 3 stages. So first was an initial interview, so no photography yet, where I'd get to ask young people about their histories with substance use and homelessness and with their social locations. I would also get to hear a little bit more about where they're at currently in life or at the time of the interviews. Then I would give them a disposable camera and give them prompts for the photography exercise. These prompts were pretty loose, and I would just say, feel free to take pictures of whatever is most important to you when it comes to your housing, your substance use, your identity, and maybe how these issues may go together or overlap. Participants had about 2 weeks to take the photos. They could take up to 27, which is what the cameras allowed. And then they would come back, I'd get the photos developed, and we'd have a follow-up interview. At that follow-up interview, we'd go through the photos one by one. I'd give the youth the opportunity to title the photos if they liked. They'd tell me about it in their own words. And then I would get to ask follow-up questions and prompts like, what is this photo about? What are we seeing here? How does it connect to your experiences with housing, substance use, etc.? And what can we learn from this photo? Or what do you want to tell us from this photo in terms of better supporting youth in your circumstances? And youth, I would say, titled the photos about half of the time. And all of the photos I'm sharing here, they consented to being shared. And most photos, they did consent. So the first study, the first research question, was looking at how substance use features in pathways to homelessness. So in that lead up. I'll walk through this. This study took a constructionist narrative approach, which really meant that it was getting at histories with these issues, kind of from a life course or retrospective perspective. It drew on a UK researcher, Glynn, her youth transitions theory. And this theory prompts researchers to think about three key concepts. So recognition, precarity, and liminality. And she developed this theory first in the context of youth leaving the child welfare system, but I sort of modified it and applied it for this work. So for this study, I really wanted to attend to how young people, to us LGBTQ+ youth, are seeking and pursuing recognition, even in the face of immense social and structural pressures, so in that precarious context. And how these kind of pressures and that pursuit of recognition shaped the transition into homelessness. I really thought about transitions as kind of an in-between state and as a sort of becoming, and not something that's very like clear cut or like a quick transition into homelessness or coming out, etc. From this analysis, we developed two overarching narratives about how drugs feature in the lead up to homelessness. The first we called taking refuge. And this was about substance use as survival in pathways to homelessness. And youth, really consistent with minority stress theory in the literature, you've talked about how drugs could be a source of refuge to cope with early life hardships and the intersecting minority stressors they had faced growing up and when transitioning to homelessness. So people talked about, growing up for some in poverty, for many facing family violence, including homophobia, transphobia, bullying in the community, et cetera, and how these issues had really were a real weight for these young people, and substances could help to lift that weight. So people talked about growing up in this precarious context and saying that they felt like they were living in a different world as other young people their age. Or for this photo on the right, Billy talked about feeling like a shadow of their true self growing up. And they took this photo of themselves holding a bong. You can see their shadowed outline. And they talk about using cannabis to ground themselves and kind of come into themselves in this kind of precarious context. And young people, said were very creative in how they explain this process of taking refuge. But some of the quotes were things like they were self-medicating, soothing themselves, wanting to take away the crushing feeling, and just trying to escape. And drugs could offer this escape, at least for a time. The second narrative is quite specific to gay, bi, and queer young men. And we called this from playing into precarity. And this is kind of a play on words or on party and play or sexualized substance use. And here we get at stimulants, sex, and the shift to homelessness. Young men in this study, a few of them, talked quite consistently across their narratives about how intensifying crystal methamphetamine use with sex had led to either mental health breakdown, including experiences of psychosis, admission to hospital, being certified under the Mental Health Act, and or family and financial breakdown, and how these issues had kind of culminated or come together to propel them into homelessness. I also want to highlight that it wasn't all bad when it came to young men's sexualized substance use, and many talked about experience a wealth of pleasure, intimacy, connection, and kind of that sense of joy and fulfillment that they weren't getting elsewhere in their lives. That kind of pulled them into sexualized substance use. So one young person, Cole, took this photo of a Led Zeppelin sweater, and he took this at a local bathhouse where he was hooking up for the night and also needing a place to stay for the night because he was homeless at the time. And he titled this Sex, Drugs, and Rock and Roll, and really used it to highlight the centrality of sexualized substance use in his shift to homelessness. And speaking about this, he says, I just wasn't getting the joy and fulfillment or satisfaction that I wanted out of life. So I was seeking it in a new form. And meth just so happened to be that form. And this was a similar kind of view as I think 4 other participants in this study. And then Cole goes on to say, and then that kind of just cascaded from there as his use intensified and as he experienced some negative health and social sequelae. The second paper is getting at the title of this talk, Homes of Substance. And this is about how drugs featured in the making of homelessness and in making experiences of home for 2S LGBTQ+ youth. So Lauren has this photo up top, and you might be able to see in the bottom right, there's a bottle of vodka. And next to that, you see Lauren's suitcase and some art that she made. And the art says, "Don't worry, pretty baby." Lauren took this photo to talk about how alcohol use had featured throughout her homelessness trajectory. So she had been couch surfing and shelter surfing for 3 years or so, and was using alcohol throughout that time to survive and get by. She was also using alcohol for connection, fun, and excitement with her peers throughout that process. And indeed, when she finally got into social housing and was super stoked about this, she was using alcohol as a way to celebrate and bring her friends together to feel a sense of community after all of this. So Lauren kind of gets at the many different ways alcohol had shaped her experiences of homelessness and of making and finding a home. So this paper drew on thematic analysis, so developing key themes, and perspectives from critical homelessness and drug studies. So drawing on feminist perspectives on homemaking and placemaking, I really thought about home as, again, not just that physical shelter, but an idea and a practice, and something that people really feel and want and pursue for themselves, including through drugs in this case, and not just through drugs. And then I drew on theories of narco-feminisms and an ethics of care. And I won't go into too much depth with this, but these theories really just prompt us to think beyond drugs and drug users as problem subjects, and think more critically about the scope and breadth of what drugs may be doing for people. So how drugs may have generative effects in terms of shaping young people's sense of selves, their homes, and their worlds while homeless. And then finally, I drew on a momentum stagnation analytical frame. And this is developed by Dr. Dania Fast again at UBC. And it really gets at how drugs can kind of show up in shifting rhythms and effects of homelessness. So kind of the up and down and complexity of substance use in this context. From this paper, we developed 3 themes. So the first we called chasing comforts. And this is a little overlap with the taking refuge narrative, but more specific to the context of homelessness and homemaking. So here, young people talked about using drugs to chase comforts amid homelessness and social and material inequity. And they talked about the generative potential of drugs in producing comforts like warmth, relief, the sense of being at ease, clarity, etc. These comforts were often talked about as impermanent or never fully captured. So something that they were in many ways constantly pursuing or continuing to use substances to achieve. Speaking to this, one participant, Billy, took the 2 photos on the bottom, and they titled these Uncomfortable Comfort. So one photo is of a soiled mattress under maybe Granville Bridge or a bridge downtown. And then the other photo is of kind of a nest of blankets that they had gotten together in the place they were staying. And for both photos, they talked about how they could find comfort in the most uncomfortable settings, and that they saw many other youth in their community doing the same. And just like this mattress, or just like these blankets, cannabis use for them was one way of kind of achieving that comfort. So they shared, This just really shows like how important it is, finding comfort in the most uncomfortable situations. Being homeless on the streets, like the amount of uncomfort that can cause, especially if you're young, if you're queer. I use cannabis literally just to survive that. And Billy certainly wasn't alone in that view. The second theme we called striking down stagnation. So here we get at how substance use was a means for engendering momentum as youth strove to carve out better homes and futures for themselves while homeless. And this was especially so as youth worked to get into housing or to improve their housing situations. And as they sought to escape kind of enduring circumstances of homelessness, inequity, and what many people talked about as crushing boredom. So speaking to this one person, Kyrie, they took this photo on the right, or your right, of a basketball net in Vancouver. And they had just moved from another province, were kind of fleeing homophobia, and were trying to carve out a sense of home and community and belonging for themselves in the city. And they talked about how psychedelics and psychedelics with other people was very much central to that creating a home for themselves in Vancouver and getting momentum with doing so. And they called that hoops. Another participant, he was talking about stimulant use and spoke to how he used stimulants daily in order to get by and to be able to finish his schooling and have the energy and focus to be able to go to work. And he shared, I know that when I'm using, I use to feel normal and productive. I feel productive. I feel part of society. When I use, I feel like I'm able to do things. Again, school, work, fun. And I do things instead of just sitting around all day. And that he attributed to street-based homelessness. The final theme we called producing precarity. And here we get at how just as substance use could carry important benefits for young people, it could also turn to producing new forms of precarity and harm that limited what they expected and experienced as possible with homemaking. And many young people talked about a sense of unpredictability and potential disruption to their current and future housing situations and overall livelihoods, really stemming from escalating or intensifying substance use, and in particular stimulant use in this study. So as one young person said, they shared, substance use builds you up and then it strips you down. And another young person said something similar, was like, you're coming up and down, up and down, up and down, and just really trying to find some balance there. Cole, who we introduced earlier, he took this photo of a park in Gastown, titled it Gastown. And for him, this was a place that he had often been to use substances while homeless. And for him, he really used this photo to contrast the more generative effects of his substance use, like with sexualized substance use, with the kind of standstill or lack of forward momentum that he also attributed to that intensified substance use. And kind of getting at the double-edged sword of drugs in his life, Cole shared, you just want to feel something with drugs. But the photo just kind of reminds me of the negative possibilities of doing too much of it. So the other side. Hey, this is the third and final paper I'll share with you today. So this paper is about navigating and negotiating outness for 2S LGBTQ+ youth in that context of homelessness and in precarious social housing too. And one young person, Shuri, she took this photo, and you can see she deliberately hit her face with the flash to kind of highlight how, as a young queer and trans person who uses drugs, she was actively trying to, carve out a sense of place for herself in the community, but at the same time was facing important risks and harms when doing so, especially gender-based and anti-2S LGBTQ+ violence. So she felt she had to conceal her gender at moments to maintain her safety. I'll unpack that in a little bit. So for this paper, again, we were looking at outness with gender and sexuality for the most part, but also sometimes thinking about outness with ethnocultural background. I'll show an example of that. And also outness with substance use and homelessness. This paper also took a thematic approach, and it was very much rooted in critical gender and sexuality studies. So the work of Judith Butler about gender and queer performativity, critical perspectives on masculinities, and this theoretical framework of strategic outness. And these perspectives together really highlight how gender and sexuality aren't just neat categories that we can think about, but there's something these are things that are very actively performed or that we make for ourselves, including through performing gender, expressing gender, through sexual practices, etc. And then this idea of strategic outness really prompts us to reconsider that process of coming out. So coming out is often thought of as like disclosing your sexuality or your gender to someone else, and it's kind of like a one and done process. But in this work, they really talk about how coming out is a continual, contextual social identity management strategy. And people may be out in some contexts, but not other contexts. So you could be out with your peers, but not with family, or not at work, not in school, not in a shelter, for example. And importantly, the risks and the benefits of being out very much are dependent on context. And in some contexts, there can be real health risks, safety risks, and material risks, like not getting into a shelter. This paper had 4 themes. The first one we called being out in and of harm's way. And here youth talked about how sexual and gender identity disclosure, mostly to parents, had either initiated or catalyzed their process of leaving home. Sometimes this leaving home was very abrupt. Youth were kicked out of the family home, sometimes violently. More often, however, this was a gradual process. And youth really talked about growing up in a pressure cooker environment with family or in the child welfare system, and how things had really reached a boiling point to where they felt they had to leave home to be able to survive and make a life for themselves out of that context. Unfortunately, after fleeing family violence or early life violence, many participants continued to encounter violence and harms while homeless and while in shelters. And speaking to this, one person, Christopher, took this photo. He was standing in the bushes near a park and looking into the park and titled it "Peering at the Park." And Christopher references apex predators to really speak to the risks of outness for queer and trans youth. And he says, "I'd rather take it up with a bear in the woods than the people on the street and in a homeless environment. Outness has a huge impact because it's like a target almost if you're noticeably queer or noticeably different. It's a target, like blood in the water with sharks." So really getting at the stakes of outness. The second theme is much more positive, and we call this norming outness. So here we get at how outness could be normative on the streets of Vancouver. And in fact, many people made the decision to move to Vancouver to find a more queer-affirming, trans-affirming community. And you can think about Vancouver seen as a more like cosmopolitan or queer-friendly city relative to other places. And I would say about a third of this study sample had moved from other provinces, other areas in BC, and for a couple of folks, other countries as well. In many cases because of pursuing a safer home. So talking about norming outness, one young person, they shared, "The streets of Vancouver are very gay." Like they're very gay, they said. And they talked about how being queer was a non-issue in their lives. Another person said, or Lucifer actually said, "I found more safety here and I could see more opportunities for myself." And Lucifer took this photo of Indigenous street art and titled it "Refocus." You probably can't see here, but this is like art of a figure, and it's in, depending on if you look at it in portrait or landscape mode, it's a different figure. So they talked about how they moved to Vancouver, kind of refocused their perspective on outness and being in community, and had a much more positive perspective and experience. This third theme we called concealing outness. So even though Vancouver and its streets and its youth-focused services can feel very queer, we see our pride flags and positive space signs everywhere, there are moments and situations when concealing outness suddenly becomes necessary. And youth described a number of instances of hiding and playing down their genders and their non-heterosexuality to get into services. So to get into a shelter, to get into even market housing, and also to mitigate risks for gender-based violence and anti-2S LGBTQ plus discrimination and violence. So one person talked about they were non-binary, and they talked about how at one particular moment, one night, the only shelter available to them was a men's shelter. And they talked about identifying to the service providers as a man for that night, just to be able to get into the shelter. And of course, this is something that they didn't want to do, but that they felt they had to do to have a place to stay. So they said, I chose my life over my gender. Another person, CJ, took this photo of a building in downtown Vancouver, and they used it to talk about the challenge of getting into market housing as a young queer person. And they shared, I find it way harder to find housing if I let them know I'm queer. And she really talked about, having to be the perfect tenant, or at least look like the perfect tenant when going to viewings. And she deliberately, played down her queerness by going to showings alone instead of with her girlfriend. Or if she went with her girlfriend, they would act as friends instead of a partner, to be able to kind of convince or as she said, manipulate landlords into housing. And she said manipulate because she also talked about landlords being very manipulative. So she had that other perspective. This fourth theme was about, we called it masking up. And it was about how, youth don't just play down or conceal their gender and sexuality, but they may actively resource it or, again, manipulate it. And several youth talked about kind of invoking masculine ideals, masculine gender expressions to mitigate concerns and experiences of violence while out on the street and in shelters. And this is especially so for trans, two-spirit, Indigenous, and racialized youth who really spoke to intersecting forms of violence. So again, using CJ's experience as an example, they took this photo of art in an alley, and it's hard to see here, but it is kind of like Indigenous inspired art. And she used it to talk about her views on and experiences with missing and murdered Indigenous women and girls and two-spirit people. And she talked about, as a young queer, two-spirit, First Nations person, she really constantly felt that she was at risk for violence, especially when, out in public and out on the streets. So CJ talked about, when walking around, dressing more masculine, hiding her Indigenous tattoo work, hiding her long dark hair, really as a way to protect herself in the context of gendered and racialized violence. And sorry, to read her quote, she says, I'm always worried that something might happen to me regarding my cultural background or how I present myself in terms of gender. From this study, I could go on about implications, but in a big sense, the study really provokes broad and fundamental questions about belonging and becoming for youth in the margins of the city. And it also raises more specific questions about what we can do to support and create safer and more affirming futures for 2S LGBTQ plus youth. And I hope I've been able to touch on some of the complexity of substance use and how drugs can feature in both the making of home and homelessness for youth. And I really want to emphasize that social and structural context is key to understanding and addressing the intersectionality of these issues. So we can address these through individual level or reactive interventions. And some slightly more concrete implications for policy and practice. First, supports need to better attend to the social context, meanings, and effects of 2S LGBTQ plus youth substance use and how it connects with homelessness. So really think broadly about what drugs may be doing for young people. And then approach care provision through a harm reduction approach and a substance use continuum approach. And really try to work with youth to move towards healthier relationships with substance use. For some, that may be abstinence. For others, it may be a reduction of use or using in a different way or in a different context, but really leveraging youth's agency and know-how here. Then when we get more upstream from like a systems level policy perspective, we need to be investing in safe, quality housing and meaningful social inclusion for 2S LGBTQ plus youth, and really for all youth. So if we know that people are craving that sense of home and pursuing it through drugs and through other means, what else can we do to make youth in our communities feel more at home, feel like they belong, and feel like they're secure? Finally, interventions need to get upstream and address root drivers of inequity, so social and structural determinants of health, the drug toxicity crisis, and our housing crisis, among other issues. So I've talked a lot about what we did in this study and what we learned. Also just touch really briefly on how we're getting knowledge back to community, and we have the publications, but that's just a small part of this. Back in June, we worked and hosted this photo exhibit with Vancouver's Queer Arts Festival. And I did this work with the Substance Use Beyond the Binary Youth Action Committee, which my colleague Christian, who's up there, they started with me about two to 2.5 years ago today. And this is a group that we've gotten to work with and we meet with monthly to plan research and in particular knowledge mobilization about substance use, especially with 2S LGBTQ plus youth. So the group was really instrumental in designing and actually hosting that exhibit. And we had an opening night, a Meet the Artist talk. I see a couple of familiar faces from that. And it was a really awesome turnout. There's a couple photos from the exhibit here. Obviously, I couldn't use any with too many people's faces, but it really was a great turnout. And we're currently working on a photo booklet to make permanent that experience. And also we're writing a reflection paper, which I hope to share with folks soon. I haven't touched too much on community-based participatory research or photovoice. There's lots of great reading here if folks do want to dig into that. I'm also very open to questions when we move to that in a second. And I will just end by thanking all of the people who made this work possible and meaningful. And first and foremost, that's the youth research participants and the youth advisory committee members. And although I worked with that one yak for the photo exhibit, I've also gotten to work with the Arise Youth Health Advisory Council and our caricatures, that's a tough one to say, or portraits are on the bottom there, so you can try to find my face if you have a second. And I'll also just thank all the study co-leads and funders who supported this work, including my PhD committee, their names are up there, and funders who supported either the project or scholarship funding for me. And of course, community organizations and research staff who really were instrumental in supporting recruitment. Have some references. If you really want all of these in one place, my dissertation is the top one. It's very long. And I will end it there, and thank you again for listening.